Thank you very much. Thank you, Pastor Francis. My name is Michael Paré, and I'll be talking about mental illness and mental health. Okay, so I'm a physician psychotherapist, and this talk is going to be about mental illness and mental health, of course. In my work, I treat both depression and anxiety conditions with group counseling and group psychotherapy. And I have training in a number of different kinds of psychotherapy. And I also teach psychotherapy. I'm a mentor and supervisor of psychotherapy. So as a young man in my early 20s, I was seriously mentally ill. And at that time, and let me see, my slides aren't working here. Okay, sorry. As an atheist who rejected God, I was suffering serious and prolonged depressive illness. But that's another story. I won't really talk about that. Over the years, I was able to get help from a number of secular psychotherapists and counselors. Eventually, I found a special counselor who was the most helpful of all, and that was our Lord Jesus Christ. So the Old Testament says that Jesus is our wonderful counselor. Of course, that's only one of his titles. He's also Mighty God, Everlasting Father, and Prince of Peace. We are all wounded. Mental health disorders happen to you and me. The Bible says, in this world you will have tribulation, but take heart. As Jesus says, I have overcome the world. And the Bible also says in Psalms 46, God is our refuge and strength, a very present help in trouble. Now, here's some facts from the National Institute of Mental Health Disorders. Is a mental health problems a problem, a significant problem? Yes, look at these statistics. 1 in 4 adults have a diagnosable mental health disorder in any given year. Many people suffer from more than one disorder at a time. Women are almost twice as likely to suffer from major depression disorder than men are. Most people who commit suicide have a diagnosable mental disorder, commonly either depressive disorder and or substance abuse disorder, or both actually. And 20% of people aged 18 to 54 have an anxiety disorder in any given year. So why are we Christians choosing not to share our struggles with Christian friends? Well, there's a lot of reasons. One is fear of judgment and fear of rejection. As Pastor Francis said already, stigma is a major concern. So stigma concerning mental illness is a concern within the Christian church and also in the public at large. People may not want to share because they think that others will be upset that they don't get their act together. They can't get their stuff together when the individual is struggling with things on an ongoing basis. And then some people would think everybody else seems so perfect, but nobody's perfect. Only God is perfect. Okay, so I'm just going to go on to the next slide. So what is mental illness? What is mental health? Well, mental illness and mental health are two distinct but interrelated concepts. Honestly, these are massive topics, and I could use 10 or 20 hours to explain, but I only have 30 minutes. A mental illness is a diagnosable medical condition where a person's thinking, mood, and their behaviors can negatively and severely impact their functioning in life. A secular view of mental health is defined as a person's ability to enjoy life, work productively, manage life's challenges, and feel contentment. A Christian perspective on mental health will add to this list. When my thinking is closest to God's thinking, when I conform to and follow and really know God, then I will truly have mental health. So mental illnesses are real. They are partly biological and partly psychological. There is also a social aspect. Mental illnesses are somewhat mysterious and may indeed sometimes be entirely beyond a scientific explanation. Even secular authorities are now including spiritual factors as causes of mental illnesses. Yet sin may not be directly involved. To blame mental illnesses simply on sin or a lack of faith is wrong and destructive and unfair. The global church is beginning to recognize that mental illnesses must be a major priority of Christian ministry. Mental illnesses are usually the result of a combination of many factors, including family, environment, biology, personality, etc., etc. Traumatic events also recognized as a major cause of mental illness problems. The lack of attention to mental health and mental illness, both by the church and by secular society, has left thousands of people with mental health problems stigmatized as spiritually deficient. Myth: if you are feeling emotionally broken, your faith is weak. That's not true. The truth is that seeking emotional healing may be the most powerful act of faith and courage that God is calling you to make. The causes of mental illness are unclear. The diagnosis and treatment are imperfect. There are many different models of diagnosis and treatment. There's actually 1,000 kinds of psychotherapy, amazing as it sounds. The medical model is insufficient. Diagnosis is always clinical and uncertain. If you take from today's session that these issues are much more complicated and complex than you had previously thought, then I have done my job. There is ignorance, fear, and stigma around mental illness. I want to help break the stigma. That's why I self-disclose about my own mental illness. I can do that because I recovered. And I think the other speakers, some of the other speakers will do the same. I appreciate that. So that will break the stigma to some extent. We need to keep working to break the stigma. Now I'm just going to switch it up here a little bit and just ask you a question. Do you have a brain? Well, of course you have a brain. That's how you got here. You had to move here and set yourself up in front of your computer. You had to have a brain. To listen to me, you have to have a brain. To see the slides, you have to have a brain. Then at least you have some mental health. You have some mental health. But it's true that just like any other organ in your body, your brain can experience some variations in wellness and sometimes become ill. The comedian Ruby Wax said it well when she said, why, when you have a mental disease, is it always considered an act of imagination? Why is it that every organ in your body can get sick and you get sympathy except the brain? And it's because of stigma. She also said, 1 in 5 people have dandruff. 1 in 4 people have had a mental illness. I have had both, she said. I think I have too, actually. And she's involved with this Time to Change, which is an anti-stigma process, and you can look it up on the internet. So let's talk a little bit more about mental illness. Mental illnesses can affect your thinking, your mood, and your behavior, and usually all three. Some can occur for a short time, and some can occur over a much longer period of time. Some can be chronic, but most can be treated. Mental illnesses can affect the functioning of your brain and the interpersonal functioning of yourself in life. These are real and diagnosable medical conditions. There are many types of mental disorders. I just give you a list, anxiety disorders, but there's several different kinds. And we could do a session on each one of these. Attention deficit disorder, eating disorders, substance use disorders, mood disorders, personality disorders, psychotic disorders, addictive behavioral disorders, and developmental disorders. Each one of these could be a 2-hour session. So why talk about this? When we promote mental health, we help people improve their sense of well-being, or try to anyway. We have more positive self-esteem. We try to encourage that. Be kind to yourself. Be kind to others. Some of my patients basically hate themselves and tell me that. People see themselves as more valued and as contributing members of their communities. People are not alone. Mental health promotion also helps build emotional resilience in people. This helps them cope better during life's many challenges. Have you noticed that life is pretty challenging, very challenging, and that's an understatement. So some of the things about mental illness is get help early. The sooner you get help, the sooner you will bounce back to your functioning before the mental illness. Talk to your family and or your family doctor and let them know what's going on. Get a referral. Talk about your feelings. It's like a release valve and will help you and make you stronger. Tap into wellness resources, exercise such as walking, bicycling, etc., and anything that will keep you moving. Connect with others and try to get help, and also give help to others. That can help you by giving help to others. Have understanding and compassion for yourself and positive care towards yourself and others. Okay, on this slide, I show that commonly used terms of mental illness and mental health are not so simple, because we have a number of other words or phrases that are used to describe these two concepts. So you can see that distinguishing between a mental illness and mental health is not going to be so straightforward. Nevertheless, mental illness and mental health are different, and as we'll talk about. Here are some of the warning signs of mental illness. Now, because there's over 300 mental illnesses, you couldn't possibly have an exact list of warning signs, because of course each illness would be somewhat different, of course, but these are some of the warning signs of the most common and serious mental illnesses. And so let's just go through this. Diagnosing a mental illness isn't a straightforward science. We can't test it the same way we can test for blood sugar levels in diabetes. A condition has its own set of unique symptoms and unique signs, and the symptoms and signs overlap between different illnesses. So common signs and symptoms can include feeling sad or very sad and withdrawn for more than 2 weeks, trying to harm oneself or end one's life, or making plans to do so. Now, I'm not going to read all these because you can read them probably faster than I can read them. So you can see the next one, being out of control. And then, of course, sudden overwhelming fear for no particular reason is also a sign of mental illness. Significant weight loss and weight gain, seeing and hearing things that aren't there, that aren't real. That would be hallucination. And then, of course, excessive use of alcohol or drugs, or addictions of other sorts as well. And then drastic changes in mood, etc. Difficulty concentrating or staying still, and intense worries or fears that go way beyond what other people would concur were reasonable. So these are some of the warning signs of mental illness. Now, how are mental illness diagnoses formulated? Well, it's by a system, and this is the major system in the world. There's other systems, but this one, let's just focus on this one because it's the most common. It's the Diagnostical and Statistical Manual of the American Psychiatric Association, and it's called the DSM system. So here it is. The Diagnostical and Statistical Manual of Mental Disorders is the official system for identifying and categorizing mental illnesses and mental disorders. The DSM provides lists of descriptions of thinking, feeling, and behaving that fit the various diagnostic categories. Only psychiatrists and other physicians and only psychologists can diagnose mental illnesses. They use these DSM categories to specify the patient's mental disorders. So the definition of a mental disorder is quite complicated. It is a clinically significant behavior or psychological syndrome, which is a pattern of symptoms and behaviors that occurs in an individual person. It's not in the family, not in a group of people, it's in an individual. And that it is associated with present distress or disability. So the person is having trouble coping in certain ways. Or is associated with a significant increased risk of suffering death, pain, disability, or an important loss of freedom. So let's take a quick clinical case. Now, this is just very quick. It's not a complete case. Obviously, I don't have time. And this is an example of a lady who has extreme anxiety. Now, extreme anxiety is not a disorder. It would be a mood state. It would be something related to a chief complaint. It could be something she's suffering, maybe something she tells her family or her doctor. And in fact, in this case, which I made up, I am entirely responsible for all the people in the school, the students and the teachers and the staff, and I can't sleep at night. Now, this would be maybe the first thing she says to a doctor if she comes to her family doctor, and then the doctor would ask a whole bunch of questions and get a whole bunch of history and then start to formulate a possible diagnosis. Obviously, it might be an anxiety disorder, or it could be something else. And the diagnosis is a clinical diagnosis, meaning she has to be asked a lot of questions, which I'll cover right here. And I'm not saying this is the diagnosis. I'm not even going to make a diagnosis because we don't have time. To officially diagnose a mental disorder, many criteria must be determined to be present. So I'm not expecting you to read that list. It's too small, but you can see the time needed to ask a whole bunch of questions of the patient to see if they have the criteria of symptoms and signs that would point to a certain mental disorder. Again, let's continue the definition. Mental illness is not merely an expectable and culturally sanctioned response to a particular event, such as the death of a loved one. This would be a grief reaction, and I'll show you in a second and talk about that a little bit more. Again, it must be within an individual and mental disorder, and the DSM classifies disorders and not people. So someone may be suffering an illness called schizophrenia, that's a mental disorder, but they should not be labeled a schizophrenic. That's incorrect. So here's clinical case number 2. Again, very quick case. This is a woman who's crying. She's grieving. She's terribly grieving because she lost her 10-year-old daughter. I made up the case, so I won't go into detail because there's no detail. I just made that up. And so she's very sad, understandably. She has a very intense grief reaction. And she has many characteristics what would point to a mental illness, but because in this case it's expectable that she would have this massive emotional response. In a sense, it's expectable. It's in a sense reasonable under the circumstance. So she would not meet a criteria for a mental disorder at this time. Now, if several months later she's still having all of these symptoms, then she probably would meet the criteria of maybe a depressive disorder if it continues for many months. So to diagnose a mental illness, doctors will look at your experiences. Grouping of certain feelings, behaviors, and physical symptoms may suggest different diagnoses. How long you have been experiencing these things, also the impact these symptoms are having on your life. They may ask you questions about your mood, your thoughts, your behaviors, and sometimes by using questionnaires or forms that you fill out, that will help the doctor they will base your diagnosis on what you describe. And for example, if you tell the doctor that you've been experiencing very low mood and low energy and maybe hopelessness, that would definitely point towards depressive illness. If your symptoms change, you might find yourself given a different diagnosis over time, because the doctor will base the diagnosis on the symptoms and what you describe to them. So to confirm a mental illness, a patient must speak to a physician or psychologist, and the answers may point to a certain mental illness or different mental illness. And the patient has to answer many questions about their thoughts, their emotions, and their behaviors. And it takes a lot of skill and experience as well as training. So please do not confuse your Google search about mental illness, let's say, with my medical degree. In other words, my medical degree and all the other training I have and all the experience I've had over many years would allow me to diagnose mental illness. And even then, I'm very careful because it's so complicated. So a physician needs to know about thinking, feeling, and behavior. Here we have an image of a man who looks like he has insomnia and he's thinking about all these things. The doctor's going to want to know a little bit about that. And she's feeling really sad and she's curled up in a fetal position, and the doctor will need to know about that as well. And the woman here is crying over spilt milk. The cat knocked over the milk, and she's really reacting. And she even understands that her reaction to that was exaggerated, and she's telling the doctor about that. And all of that information can be used to help the doctor diagnose a mental illness. Now, who has a mental illness, and can you look at somebody and see it? Here's 5 young people, and I think all of them are smiling except the guy on the right, far right. And my question is, can you tell who's suffering from a mental illness? And the answer is no, you can't. Mental illnesses are always invisible, but some of the behavior that indicates a mental illness may be visible. But just because he's not smiling, it doesn't mean much. And just because somebody is smiling, it doesn't mean that much. Also, we want to make sure we don't diagnose people who are eccentric rather than mentally ill. So being eccentric is different, and I don't necessarily recommend it, but it isn't a mental illness. So for example, these 2 individuals who you probably recognize are eccentric, and they were eccentric in many ways, but they were also geniuses, and their eccentric behavior is not a mental illness. And we want to make sure that we don't call being eccentric a mental illness, because these 2 individuals are, I wouldn't recommend you do your hair like this. You could be bullied. It's sort of funny. It's sort of strange though, and some people will react against it. So it would be called eccentric by some people, and so psychologists may call it socially deviant as well though. But that's not a mental illness. This woman is looking, calm and happy, and she doesn't look like she has mental illness, but actually she is self-described as mentally having mental illness, and she's a face of mental illness from the internet. So she came forward, but she has a mental illness, but she doesn't look like it. Now, this woman looks very socially deviant, no doubt about it. And you might look at her and think she must be mentally ill. She gave herself some very scary looks, that's for sure, with tattoos, metal horns, and etc. But amazingly, this vampire lady, she's not really a vampire, is a lawyer. And she actually helps out and devotes her time to helping domestic violence victims, as she was. She was a victim of domestic violence. And so don't judge a book by its cover. These 2 people are troubled mentally and or upset, but I'm saying they're not mentally ill. To be troubled mentally is part of life, a lot of life actually, but it doesn't mean somebody's mentally ill. And this man is smiling, but behind the mask, he's actually quite ill. He has a dangerous and hidden mental health problem. In fact, he's depressed, but we wouldn't know that because he fakes it. And this woman, she looks happy and fine until you realize it's just a mask. I'm going to be continuing here with this woman is seriously mentally ill with schizophrenia, and she's in remission right now, and you can't tell. She looks quite intelligent, she looks quite likable, and she's smiling, but she has significant mental illness. So you can't see that, and so don't judge either somebody who's smiling doesn't have a mental illness, or somebody who looks quite upset does have a mental illness, not necessarily. So I'm going to go on to a definition of mental health now. Now, the World Health Organization, here I'm talking about, up here is they talk about mental illness. So we've covered that. So the first paragraph here is really talking about that. You can read it, and it's talking about regular types of medical conditions like depression, anxiety, psychosis, etc. What I want to focus on here is mental health, which is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. Okay, so that's what mental health is, and we're going to talk a little bit more about that. So here's a number of characteristics of mental health, and it's here we say it's related to overall physical health, home life, and aiming for good sleep. So let me just go into a little bit more detail. Mental health is also helped by exercise and getting a good balanced diet. Manage your diseases or symptoms. Make informed, healthy choices that support physical and emotional well-being. Be careful about how much alcohol you drink or drugs you take, marijuana, etc. Home life should be stable and safe place to live if possible. Aim for good sleep. Sometimes it may not be possible to get the recommended 7 to 8 hours of sleep a night, but aim for that in the next several days after that. Being in the habit of getting sleep can be very beneficial to many things. Learning, it's better for learning. It's better for the immune system, amazing as it sounds. Other mental health issues are purpose and meaning, community and acceptance. Meaningful daily activities such as a job, a school, or volunteering are important. They can help your mental health. Prayer and worship are important. Religious activity is associated strongly with mental health. Self-care and family caretaking is important. Creative activities can be quite useful and helpful. Relationships and social networks that provide support are essential. We are social beings. Human beings are social beings. So look out for connection with friendship, love, and hope. Acceptance of yourself and others is very important. Some of my patients hate themselves. That's not fair. It's not reasonable. And so we need to do that. We all have our strengths and we all have our weaknesses, no doubt. But by accepting who you are, you get one step closer to being comfortable with yourself and with others. So here is a kind of comparison of mental health is and mental illness isn't. Okay, so mental health is more than just not having a mental illness. Something everyone has some of, something linked to physical illness, not a medical diagnosis, worth taking time for. So you have to put some energy in sometimes. Part of being a human being, something we need to look after. So putting in that effort. Living more abundantly and closer to your full potential. So mental illness isn't official unless a physician or psychologist does a clinical assessment of a patient and reaches a conclusion of mental illness. It's not all in our head or mind. It's something someone decides to have. It isn't something someone decides to have. It isn't something to think about only when you feel broken. And it isn't interchangeable with the term mental health. They're different. Mental illness is different than mental health. And it isn't something you can just snap out of, although some people think you can. Mental illness is a vastly complex concept. We did not reach any clear answers today. And so the reason is that each one of these disorders is complicated in its own right. And it would take me at least an hour to introduce each mental illness, and maybe 2 hours. But maybe in the future we'll do that. Except that the only thing that we did establish is that mental illnesses are real. They are partly biological and partly psychological. There's actually a social element to it because we're social animals. And so we need to socialize with each individual. People have to connect with other people, and often there's fears to do that. That's social anxiety disorder. So mental illnesses are also mysterious at some point, and may indeed sometimes be entirely beyond a scientific explanation. Diagnosis by any method is limited, and there are many different types of diagnosis, but it's still useful. It is limited, but it's still useful. The deepest understandings of the world's professionals is much more modest than you would expect. So psychiatry is studying mental illness in many different ways. They're studying the brain in many different ways. And so is psychology, neuroscience, cognitive psychology, sociology, and other professional areas of looking at it, epidemiology. But it's still very hard to really understand. So I'm going to conclude. I'll probably be shorter than my allotted time, but that's good. The Surgeon General of the USA has determined in a major expert scientific report on mental illness that the good news is there's efficacy of mental illness treatments that is well proven scientifically. Now, of course, some of these treatments are medication, some are psychotherapy, and some are being admitted into hospital, etc. And of course, one of the things is there's many kinds of treatments, and again, very complicated. There's 1,000 kinds of psychotherapy. And so each one of those would be complicated to describe in any detail. There's also a range of treatments that exist for most mental disorders. So somebody may not want a medication, they can do psychotherapy, or they don't want psychotherapy, they could take medication. You should seek help, they advise, if you have a mental illness problem, or even if you think that you or someone you love has the symptoms of a mental disorder. So even if you're not sure, it's still worthwhile to seek help. Actually, a lot of my patients don't have a mental illness. They have stress, they have worries, and psychotherapy can be helpful to them as well. They don't actually have to have a mental illness for psychotherapy to be effective. So a Christian mental health is when my thinking is closest to God's thinking, or closer anyway. When I genuinely seek, conform to, and really know God, then I will truly have mental health. The Bible in Psalm 16:11, and this psalm was attributed to David, and David says this to God: "You will show me the path of life. In your presence is fullness of joy. At your right hand are pleasures forevermore." The scripture frankly acknowledges our mental suffering. And this is from Psalm 34. "I thank you, Lord, that you are close to the brokenhearted and save those who are crushed in spirit." That's Psalm 34:18. And Psalm 23:4, "Lord, I thank you that you are my shepherd. Even though I walk through the darkest valley, I will fear no evil, for you are with me. Your rod and your staff, they comfort me." Thank you very much.